All right. By popular demand, I'm going to do a sort of full review of the Andrew Cuomo COVID cover-up claims that are circulating so we can try to sort of sort out what's truth and what's lies and what we know about and what we don't know about and sort of what's relevant to policy versus what are sort of like the more personal scandals in which Andrew Cuomo is now embroiled. So let's get right into it. Earlier in the pandemic, New York Democratic Governor Andrew Cuomo was seen as sort of a model governor in responding to the pandemic. And despite New York being hit very hard early, believed to be because of the number of nonstop flights, both to China, sort of like source one for the virus, and Italy and surrounding parts of Europe, sort of like source two for the virus in the United States. Despite that, the idea was that Cuomo handled the virus as well as was possible given what we knew at the time and ramped up testing relatively quickly as feasible, put in place guidelines, did shutdowns as necessary. And while much of the United States had three spikes, New York was able to completely suppress the what was typically spike two for much of the country in the middle of the summer. And they had basically the initial spike and then the fall spike, limiting themselves to two spikes rather than three, thanks to Andrew Cuomo's great work. Now, until more recently, some very serious allegations of the covering up of deaths have surfaced. So let's go through the allegations. From the emails I've gotten, a lot of people don't actually understand what is even being alleged. Now, I want to be upfront that much of this is still disputed and contested, and just about every report has some detail that is not, at least yet, confirmed. But we're going to do the best we can to parse through the evidence we have. The big scandal and the big allegation is that at Andrew Cuomo's either direction or indifference, nursing home COVID deaths were undercounted by the state, allegedly to the tune of thousands of nursing home COVID deaths. And indeed, the New York Health Department has made public data that added more than 3,800 nursing home deaths to their tally after this story broke. And the state now acknowledges that they upped nursing home deaths by about 40%. Now, it's really important to be clear here, and this is what a lot of people may be missing. This is not an allegation that New York undercounted COVID deaths. Nationally, even globally, we believe that there have been far more COVID deaths than the official numbers because of people who died, including at home, and were never tested. But the allegation is not that the full public number of New York COVID deaths is being artificially suppressed any more than just we're probably undercounting COVID deaths at a global level. The current New York COVID death toll is about 47,000, and that has nothing to do with these allegations. What's at issue is how many nursing home residents died. And our best understanding of the undercount is that there were thousands of nursing home residents who became so sick that they went to a hospital, died in the hospital, and they were not counted as nursing home deaths. Now, in a literal sense, they did die at the hospital, but we all understand that if you are a nursing home resident who catches the virus at a nursing home, you should be counted as a nursing home death from the standpoint of evaluating how well did Andrew Cuomo protect nursing home residents. And that's the crux of this. Even if the total number of deaths is not being lied about, if you undercount nursing home deaths, you are making it seem as though you are much better protecting nursing homes than you really are. So this is dishonest, and Andrew Cuomo has to be held accountable. This has a real impact. It's not just academic. It's not just a number. Families make decisions about facilities for loved ones, in part based on whether they believe their loved ones will or won't be safe at nursing homes. If you falsely believe that there are way fewer nursing home COVID deaths than there really are, you might make a decision about a loved one based on those deceptive statistics. So this is very real, very serious, and it has a real world impact. Now, what are the defenses? The defenses are what we heard from Health Commissioner Howard Zucker from New York, which is that the state website had always been clear that deaths it listed for nursing homes did not include deaths that took place outside the facility, and that the total number of deaths was never undercounted. That's the defense from the New York Health Department. Then there's the second piece of this, which is the criticism that New York State sent nursing home residents who were hospitalized back to nursing homes in cases where they shouldn't have been sent back. This one is more nebulous right now. We're still learning more about it. Andrew Cuomo is defending this and saying that everybody that was sent back in adherence to, in compliance with federal guidelines, and that they didn't do anything that was wrong. Now, on the second issue, I'm not really able to put together a definitive take on it. We just need more information about that. Now, separately, and this is a lot of stuff happening all at once to Andrew Cuomo. Separately, there are allegations of Andrew Cuomo being basically a bad guy, bullying employees and treating employees terribly. I see this as important, but secondary to the COVID scandal. It's a lot of he said, she said. I can't possibly analyze it in any serious way other than to say all of the allegations should be investigated and the cards should fall where they may. I don't care that Andrew Cuomo is a Democrat. Whatever is uncovered should be what it is, and it should be dealt with. And then lastly, there are also now new allegations of inappropriate sexual advances and conduct by Andrew Cuomo. Lindsey Boylan, who worked for Cuomo as an aide, says that on a private jet, Cuomo suggested playing strip poker, which made her feel uncomfortable. Boylan says that happened after she was promoted to be Cuomo's deputy secretary for economic development and a special advisor to him. She said she initially turned the job down because she didn't want to be near him, ultimately accepted it. Boylan also is describing an incident where they were in his office in New York City on 3rd Avenue. And when she got up to leave and walk out a door, that Andrew Cuomo allegedly stepped in front of her, kissed her on the lips, and that she was shocked, but just kept walking out. Now, this is totally separate, and this allegation has to be taken seriously and fully pursued. So that's the story as I understand it. Some of the emails I received were implying I wasn't going to talk about this because Cuomo's a Democrat. First of all, we talked about this last week for a while on the bonus show. Secondly, I've said a million times, I don't care about these politicians beyond they're doing things for the people. I don't care if they're Democrats or Republicans. I never defended, Anthony Weiner. I don't deify politicians. They all have good and bad. And why wouldn't I talk about Andrew Cuomo? Investigate every single thing. If the people of New York want him to resign, he should consider resignation. If there are criminal wrongdoings, then investigate and prosecute. We don't ignore stories because it's a Democrat on this show. That is the full story as I understand it. So really sort of like 4 stories: the undercount of nursing home deaths, sending patients from hospitals back to nursing homes, the bullying of employees, and the alleged sexual harassment of Lindsey Boylan. Those are the 4 stories as I understand them. They are separate stories. We could sort of group them as the 2 COVID stories and the 2 bullying and harassment stories. And we'll just have to follow all of them and see where the cards fall. If you are anything like me, you probably aren't thrilled with the idea of going into a doctor's office right now. And thankfully, there's a practical and affordable way to take control of your health and get personalized care from the comfort of your home. It's a service called SteadyMD. They're one of our sponsors. You take a quiz, you get matched with a licensed primary care physician who understands your health needs. You have a 1-hour video call with your new doctor. You establish a meaningful relationship with them. And after that, your doctor is available to you anytime by text, phone, or video chat. This is not a random doctor on call. Each doctor at SteadyMD has a limited number of patients, so they actually have time to listen to you. You get the personal attention that you deserve. They can do almost everything an in-person doctor can do: perform medical evaluations, talk to you about health concerns, send prescriptions to your home or local pharmacy, and anything they can't do online, they'll quickly set you up with an in-person provider to do, things like blood tests, as an example. You don't need insurance. It's only $99 a month with no other fees or copays. There are so many practical advantages to using SteadyMD for primary care, and it's also so much more affordable Go to steadymd.com/Pakman to take the free quiz, see which doctor is right for you. I took their quiz. They matched me with a doctor who specializes in my particular health needs and situation. The doctor they gave me is a really perfect fit for me and my medical needs. There's no risk, no commitment to get started. Just click the link right underneath this video.